People who care for loved ones with memory problems face really significant emotional, physical, and health-related challenges. A new report from the Alzheimer's Association shows the hours of unpaid caregiving in the state of Texas is 1.5 billion. And joining us is Andrea Taurins. She is the executive director of the Capital of Texas Alzheimer's Association chapter. As always, thank you so much for being here today.
Happy to be here.
Thank you. A lot of data to dig into. Let's get to the why first, because I think, we've seen this number grow, the burden grow, we've seen the number grow. And there was an interesting stat that I saw. According to the report, an estimated 1.2 million additional direct care workers will be needed between 2020 and 2030, and more new workers than in any other single occupation in the United States. So do we feel like what's contributing to this burden growing is because of the lack of that?
Well, there's a significant lack of workers right now, and as the prevalence of Alzheimer's and other dementia grows, that need is going to continue to grow as well. And there's a shortage not just of direct care workers such as home health aides, nurse assistants, and specialists as well that are specializing in dementia care. So those shortages are contributing to difficulties in diagnosis, in the care, and in the support services for those who are going through Alzheimer's and dementia.
Okay, and caregivers obviously give so much to others, but now they're reporting that they have more chronic conditions.
They do. Caregivers for those with dementia, Alzheimer's and dementia, are reporting a higher level of depression, of anxiety, and even chronic diseases, like you said, of heart disease and things along those lines, just because there is such a stress for caring for someone with Alzheimer's and dementia that those reports are actually higher than caregivers for some other diseases.
Okay, and we know that there is a special report that finds there needs to be earlier discussions of really cognitive concerns.
Absolutely, and that shortage in medical specialists is contributing to that issue as well. But people, when they start experiencing cognitive issues or thought issues, fear and anxiety can lead to them not feeling comfortable saying something to their doctors. And what the report is showing is that some primary care physicians aren't bringing that up with their patients. They're waiting for the families or the individual to bring it up. And also they're afraid of, if they do, there's not enough specialists, there's not enough resources out there for someone who does have that diagnosis, so they may not diagnose. So it's important that you mention, these differences to the doctor so that they can adequately, diagnose what's happening. And lots of people think it's just normal aging.
Yeah.
That's just what's going on. But it could be something more. So speaking to your doctor is important.
And you touched on one solution right there, what families need to really focus on. But what are solutions for the caregivers? What can they do? We see that resources are dwindling, the burden is growing. So what can they do?
Well, they can call the Alzheimer's Association. We have support resources for caregivers. We can help them understand what resources are available in their own community and what questions to ask the doctor, what to look for, what are the 10 warning signs of Alzheimer's dementia. Just help them understand and also develop that language to be able to speak with their physician or their loved one's physician to understand what's happening. Is it normal aging, or is it something that we need to look more in depth at to understand how we can best support and help that person?
Okay, Andrea from the Alzheimer's Association, as always, thank you, and we'll have a list of resources on our website at kxan.com.